That makes 3. That makes 4. Did you get your change?
No, you got it.
You sure?
Here you go. Somebody else.
Man, this brother can count, man, you know. Why can't I get somebody to flunk special ed? Damn. This ain't right. Okay, so basically I'm just going to talk a little bit and then get into the question and answers they call Q&A, because a lot of people have little maladies that they have and they want to know some kind of solution to it. So I'm available to answer your questions. And I don't want to hear anything about a quick question, because quick questions don't necessarily mean I have a quick answer. So don't even go with that quick question stuff. I don't like that. And don't say you know, because I don't know. You know. Don't say that to me. Okay. Anybody got a quick question? Yes, sir.
Could you comment on, I guess, the necessity or efficacy females wearing dresses and skirts as opposed to pants or pantaloons? The critical nature of that, if you see it as such.
Okay. Well, that goes for usually it's synthetic underwear, panty, drawers, and synthetic thongs. They stop the correct amount of oxygen to getting to the vaginal shaft. And the pants do the same thing. It usually spikes a yeast infection and then speeds up the deterioration of the reproductive system of the female. The tight pants, you know, where you can count the veins in the ass, they're unhealthy and rather dangerous. So it would be better to wear the dresses, the skirts, as you say, than those pants. Yes. Any more? Yes, ma'am.
To get off the kidney dialysis machines, going to get off of that problem.
Yes.
Kidney dialysis.
Yes. So to get off the dialysizing your urine and blood to get rid of the waste, you can't eat anything that contributes to the accumulation of waste. So that's the elimination of what we call junk food and fried foods and white sugar and white rice and things of that sort. So the diet is rather strict. You don't want to go with any artificial sweeteners, aspartame, because that causes nerve damage, which will further exacerbate the situation. So the diet itself would have to be rather strict. There's no problem if they follow the diet and don't eat things that accumulate the waste, which salt is a no-no anyway. And of course, they have to take the herbs that I mentioned before, along with the glucosamine and chondroitin to rebuild the tissue, and comfrey, which is a herb. And those help rebuild tissue, because we're trying to rebuild the kidney. So we need the glucosamine and chondroitin, which I mentioned before when I showed the joint people that are running and jogging. I mentioned that supplement. So they need the glucosamine and chondroitin and a herb called comfrey, along with the ones I mentioned, the goldenrod, the sarsaparilla, the thuja, you remember? And the sarsaparilla? Yeah, along with that. And they can also get a glandular from the health food store. It will be called a glandular, and it will say kidney. You get a kidney glandular, and that will help the situation. Yes?
Yes, what is the cause of eczema and some possible remedies for it?
Eczema and psoriasis usually go together, and they do have such supplements in the health food store called eczema and psoriasis. Sometimes they treat that with zinc liquid. It's called Dermazinc, which is good for dandruff, as another brother mentioned, and eczema and psoriasis. I'll give you the phone number in a minute. As you know, the skin is reacting to something coming out of it. And usually that something coming out of it is causing the skin to deteriorate and, of course, irritating the skin, which we sometimes call rashes, bumps, and things of that sort. So it's the kidney not getting rid of the waste, and so the waste is being dumped into the skin. So we need to strengthen the kidney with those herbs that I mentioned, because apparently the kidney is losing their ability to dilute substances. Because the kidneys do two things: they dilute and concentrate. And usually if the kidneys lose their ability to concentrate, that means the kidneys filter out of the urine the minerals that you need, the copper and the zinc and the iron. An example of a kidneys losing their ability to concentrate would be iron deficiency anemia, which is actually a kidney disease. So we're looking at another side of the kidney having the disease called diluting. So it's losing its ability to dilute. So therefore we have to strengthen the kidney, and we use a zinc. That's a mineral that men like to get when they eat oysters because it's high in the prostate area, along with selenium. So we use a cream called zinc cream, and there's a stronger version of that that you can get called dermalogic.com, and you can go to that and pull that up. I'll give you the phone number later on as well. If you're going back to the origin of the thing, it's usually stress in the third trimester of the lady's pregnancy, the prenatal growth and development of the child. It may have caused that stress in the third trimester, when a certain hormone is secreted to help the lungs get ready to expand and go into this oxygenation process. Stress in the first trimester is usually a kind of nerve damage stuff that will happen later in the child's life. Stress in the second trimester is usually caused there's some kind of gender confusion, which if you overstress the lady, then it may lead the child toward homosexual tendencies or something. So that's usually second trimester stress, gender confusion, tomboyish girls and feminine boys are stress in the second trimester. Nerve damage is usually stress in the first trimester. And respiratory kind of illnesses and eczema is usually the third trimester. Essentially, if you can stress the lady during pregnancy, you can just about manipulate a race. Yeah. Yes, ma'am.
Taking supplements. Some of the supplements you take 3 times a day and every day, can they become toxic in your body if you take it often?
Well, the problem in treating people is what we call compliance, patient compliance. In other words, will they follow your rules? No. So they would have to be rather consistent and follow your rules for that to happen. And the supplements are not sold at a therapeutic dosage. They're sold at a serving dosage. So the indication on the label, take 3 times a day, is what they have to indicate by law, because the herbs or supplements are classified as a food. And all foods have to have a serving on the label. So they're indicating a serving, not a therapeutic dosage. There's no way in the range of a therapeutic dosage. How we calculate a therapeutic dosage is giving a supplement until the person has diarrhea from it. And then we back off about 100 milligrams. Then we're in a therapeutic range. But I very seldom do that, because if I tell somebody that and make them shit all day, and they say, he's not helping me. So I very seldom really push that, get into a real therapeutic range. I just go by the label and double it and do some little swagging things. No, they won't get into any problems. Usually this damage that they're telling you that occurs from certain supplements is done on monkeys or rats. And they'll say this is damaging, but they're not telling you how much dosage they gave to the monkey or rat. There's studies out that glucosamine chondroitin is harmful to your liver. But the dosage they gave to the rat was equal to 200,000 milligrams of glucosamine and chondroitin twice a day, if you do the conversions. So they don't mention that part. That's way beyond what a rat can endure. Rat can barely live off of food from Harlem. That's another issue altogether. Yes, ma'am.
As you know, I am a postal worker.
Yes.
And I have to have my cup of coffee before I go into the building.
Yeah, you look like a stamp.
So I don't realize the effects while I'm drinking it, but if I stop, my whole body shuts down.
You're addicted to coffee.
Right.
You need a supplement called caffeine, for homeopathic remedy,
Okay.
and crave less. And that will pull you off of it. You can't come off of coffee as easy as you think.
Right.
You will get really whacked from that.
Yeah.
And you're not making your own coffee at home, are you?
No.
You're just a coffee junkie at work? Hello?
Yes.
Yes, okay. So you can switch to another stimulant, such as FOTI. F-O-T-I. You can use FOTI with ginkgo, and that will drive you. But I wouldn't come off the coffee as quickly as you're doing. That's the leading cause of breast cancer, you know that.